Did you know that your kidneys filter about 50 gallons of blood every single day? Yet millions of people are walking around right now with kidney problems and don't even know it. In fact, about 9 out of 10 people with kidney disease have no idea their kidneys are struggling. What if your body has been sending you signals that something needs attention, but you just didn't know what to look for? Kidney disease is something that deserves our attention, especially as we get older. These two bean-shaped organs, about the size of your fist, sit just below your rib cage on either side of your spine. They're working hard every moment of every day, quietly doing their job without us even thinking about them. Each kidney contains about 1 million tiny filters, kind of like a very sophisticated coffee filter, but much more complex. These filters, called glomeruli, clean your blood by removing waste products and extra water, which then leave your body as urine. But that's not all your kidneys do. They also help control your blood pressure, keep your bones strong, make sure you have enough red blood cells, and maintain the right balance of important minerals like salt, potassium, and calcium in your body. The challenge with kidney problems is that they can develop slowly over time, sometimes over many years. By the time many people notice something is wrong, their kidneys may have already lost a significant amount of their filtering ability. This is why understanding the warning signs is so important. Have you ever wondered why some people seem to catch health problems early while others don't? What are the signs that your kidneys might need attention? And most importantly, how can you recognize these signals before significant damage occurs? Stay with us through this entire video because we're going to walk through 17 important signs that may indicate your kidneys need attention. Before we dive in, please subscribe to our channel and turn on notifications so you won't miss important health information like this. We'd also love to know where you're watching from. Drop a comment and tell us your location. It helps us understand our community better. Now, let's talk about how kidney disease develops and why it's so important to catch it early. Kidney disease is classified into 5 stages, based on how well your kidneys are filtering your blood. In the early stages, stage 1 and 2, your kidneys might still be doing most of their job reasonably well, and you might not notice any symptoms at all. Stage 3 is when symptoms often begin to appear, but by this point, your kidneys have already lost about half of their normal filtering ability. Stages 4 and 5 represent more advanced disease where the kidneys are struggling significantly. The good news is that if caught early, many causes of kidney disease can be treated or managed effectively. The 2 most common causes are conditions that many of us are familiar with: diabetes and high blood pressure. Both of these are conditions that can be managed with proper medical care and lifestyle adjustments. Another increasingly common cause is the regular use of over-the-counter pain medications like ibuprofen and naproxen. While these medications can be helpful for occasional pain, using them frequently or for long periods can put stress on your kidneys. Now, let's go through these 17 signs that may indicate your kidneys need attention. Remember, having one or even several of these signs doesn't necessarily mean you have kidney disease, but they are worth discussing with your doctor. Sign number 1, foamy or bubbly urine. When you use the bathroom, take a moment to look at your urine before you flush. Does it look foamy or bubbly, similar to how dish soap looks when you're washing dishes? This foam happens when a protein called albumin leaks from your blood into your urine. Think of albumin like the soap in your dishwater. Your kidneys normally keep this protein in your bloodstream where it belongs, but when the kidney filters become damaged, albumin can slip through into the urine, creating that distinctive foamy appearance. This is one of the earlier signs that can show up, and it's something you can notice yourself at home. If you see this happening regularly, it's worth mentioning to your doctor, who can do a simple urine test to check for protein. Sign number 2, swelling in your legs, ankles, or around your eyes. Have you noticed that your shoes feel tighter by the end of the day? Or that you can press your finger into your shin and it leaves a dent that stays there for a while? This is called pitting edema, and it happens when extra fluid builds up in your tissues. Your kidneys normally remove excess water from your body. When they're not working as well as they should, this water can accumulate, especially in your lower legs due to gravity, and around your eyes because the tissue there is soft and can hold water easily. If you're experiencing this kind of swelling that doesn't go away with rest and elevation, it's important to have it evaluated. Sign number 3. Getting up to urinate multiple times during the night. While it's normal to wake up once during the night to use the bathroom, especially as we get older, needing to go 3, 4, or more times every night might signal a kidney issue. This happens for a couple of reasons. When your kidneys aren't concentrating your urine properly, you produce more urine than normal. Also, fluid that pools in your legs during the day gets reabsorbed when you lie down at night, and your body tries to get rid of it. Many people dismiss this as just a normal part of aging, but if it's a new pattern or has gotten worse, it deserves medical attention. Sign number 4. Changes in your fingernails or toenails, specifically a half and half appearance. Look at your nails carefully. Do they appear to have 2 distinct colors, with the bottom half near the cuticle looking white or pale, and the top half near the tip looking pink or brownish? This peculiar pattern, called Lindsay's nails or half and half nails, can indicate kidney problems. It happens due to changes in blood flow and the buildup of certain waste products in your body that affect the nail bed. Not everyone with kidney disease develops this, but when it appears, it's worth investigating further. Sign number 5. Small, firm bumps under your skin that look whitish or yellowish. These bumps, which doctors call calcinosis cutis, feel hard when you press on them and can appear anywhere on your body, but they're often found around joints like your elbows, knees, or fingers. They occur when calcium and phosphate, 2 minerals that healthy kidneys help regulate, build up in your soft tissues because your kidneys aren't maintaining the right balance. While these bumps are usually not painful, they're a visible sign that your body's mineral balance might need attention. Sign number 6. Hardening of your arteries that shows up on X-rays. When your kidneys struggle to regulate calcium and phosphate properly, these minerals can deposit in your blood vessel walls, making them stiff and hard. Think of it like mineral buildup in old water pipes that makes them rigid and narrow. If you've had X-rays taken for any reason, and your doctor mentions seeing calcification in your arteries, especially if you're not yet at an age where this is typically common, it's worth checking your kidney function. This arterial stiffness can affect your heart and blood pressure, creating additional health challenges. Sign number 7. Severe muscle cramps, particularly at night. These aren't your typical muscle twitches. We're talking about intense, painful cramps that can wake you from sleep and leave your muscles sore afterward. They often affect your legs, but can occur in other muscles too. These cramps happen because damaged kidneys don't maintain the right balance of electrolytes, especially calcium, magnesium, and potassium, which your muscles need to work properly. Many people try to manage these with stretching or dietary changes, which can help. But persistent severe cramping should prompt a discussion with your healthcare provider. Sign number 8. Loss of height or diagnosis of osteoporosis. Your kidneys play a crucial role in keeping your bones strong. They activate vitamin D, which helps your body absorb calcium from your food. When your kidneys aren't working well, this process doesn't happen efficiently, and your bones can become weak and brittle over time. If you've noticed you're getting shorter, this isn't just normal aging. It could mean your vertebrae are compressing due to bone loss. Similarly, if a bone density scan shows osteoporosis, especially if it seems more severe than expected for your age, it's worth checking if your kidneys are part of the picture. Sign number 9. Intense itching all over your body, especially worse at night. This isn't just dry skin or an occasional itch. People with kidney problems often describe a deep, relentless itching that can be almost unbearable and typically gets worse when they're trying to sleep. This happens because waste products that should be filtered out by healthy kidneys build up in your bloodstream and irritate your skin from the inside. Moisturizers and typical itch creams usually don't help much because the problem isn't really your skin itself. If you're experiencing this kind of persistent, intense itching without an obvious cause like a rash or allergy, mention it to your doctor. Sign number 10. An overwhelming urge to move your legs when you're resting, a condition called restless leg syndrome. This feels like an almost irresistible need to move your legs, often accompanied by uncomfortable sensations that people describe as crawling, tingling, or aching deep in their leg muscles. It typically happens when you're sitting still or lying down, and moving your legs provides temporary relief. While restless leg syndrome can have various causes, it occurs much more frequently in people with kidney problems, likely due to the buildup of waste products and imbalances in minerals and certain brain chemicals that affect nerve and muscle function. Sign number 11. A persistent metallic taste in your mouth and bad breath. Imagine the taste of sucking on a penny or touching metal to your tongue. That's what many people with kidney problems experience constantly. This happens because waste products, particularly urea, build up in your blood and break down in your saliva, creating ammonia. Others might notice an unusual odor on your breath, sometimes described as fishy or ammonia-like, which is called uremic breath. This can affect your desire to eat because food doesn't taste right anymore. If you notice this metallic taste that doesn't go away, especially combined with changes in your appetite, it's worth investigating. Sign number 12. Loss of appetite along with feelings of nausea or actual vomiting. When waste products accumulate in your bloodstream because your kidneys aren't filtering them out properly, these toxins can affect your digestive system. You might feel full after eating just a small amount, or you might feel nauseated even when you haven't eaten. Some people find that certain foods they used to enjoy no longer appeal to them. This can lead to unintended weight loss, which further affects your health. Many people attribute these symptoms to stomach problems or simply getting older, but when combined with other signs, they may point to kidney issues that need attention. Sign number 13. Bruising easily and having bleeding problems like nosebleeds or bleeding gums. Have you noticed that you develop bruises from minor bumps that wouldn't have bothered you before? Or that your gums bleed when you brush your teeth, even gently? Healthy kidneys produce substances that help your blood clot normally. When kidney function declines, your blood's ability to clot properly decreases. You might also notice that when you do get a cut, it takes longer than usual to stop bleeding. While these symptoms can have other causes, when they appear along with other signs on this list, they may indicate that your kidneys need evaluation. Sign number 14. A white, powdery substance on your skin called uremic frost. This is a sign of very advanced kidney disease, though it's rare to see nowadays because most people receive treatment before reaching this stage. It occurs when the concentration of urea and other waste products in your blood becomes so high that they actually crystallize and come through your skin, appearing as a white or pale yellow powder on your skin's surface, particularly on your face and neck. If you ever notice this, it requires immediate medical attention. While you're unlikely to see this yourself, understanding that it exists helps you appreciate how important it is to catch kidney problems earlier. Sign number 15. Chest pain or pressure, particularly when lying down, which may indicate pericarditis. The pericardium is like a protective sac that surrounds your heart. When waste products build up in your blood due to kidney problems, this sac can become inflamed. A condition called uremic pericarditis. The pain can feel sharp and may get worse when you breathe deeply or lie flat, often feeling better when you sit up and lean forward. This is a serious complication that requires prompt medical attention. Any chest pain should always be evaluated by a doctor, but if you have known kidney issues and develop chest discomfort, it's particularly important to be assessed quickly. Sign number 16. Overwhelming tiredness and weakness that doesn't improve with rest. We all get tired, especially as we get older and our lives stay busy. But the fatigue from kidney disease is different. It's a deep exhaustion where even simple activities feel difficult, and rest doesn't seem to help. This happens primarily because your kidneys aren't producing enough of a hormone called erythropoietin, or EPO. This hormone tells your bone marrow to make red blood cells, which carry oxygen throughout your body. With fewer red blood cells, you develop anemia, and your body's tissues don't get the oxygen they need. This results in that persistent, tired, weak feeling. If your fatigue is severe and unexplained, a simple blood test can check both your kidney function and your red blood cell count. Sign number 17. Having no symptoms at all until the disease is advanced. This might seem contradictory after discussing 16 other signs, but it's actually one of the most important points to understand. Many people with kidney disease, particularly in the earlier stages, feel perfectly fine. Your kidneys have remarkable reserve capacity. They can continue doing their essential jobs even when significantly damaged. This is why regular checkups are so important, especially if you have risk factors like diabetes, high blood pressure, or a family history of kidney disease. Simple blood and urine tests can detect kidney problems before you ever feel sick, allowing for early intervention when treatment is most effective. Now that you understand these warning signs, let's talk about what you can do with this information. First and most importantly, if you recognize several of these signs in yourself, schedule an appointment with your doctor. Don't wait and worry. Simple tests can check your kidney function. A basic metabolic panel, which is a routine blood test, measures creatinine and can estimate how well your kidneys are filtering. A urine test can check for protein and other abnormalities. These tests are straightforward and not painful. Second, if you're using over-the-counter pain medications like ibuprofen or naproxen regularly, talk with your doctor about whether you should continue or if there are safer alternatives for your situation. For occasional pain, these medications are generally fine for most people, but daily or frequent use over months or years can gradually damage your kidneys. Thirdly, if you have diabetes or high blood pressure, work with your healthcare provider to keep these conditions well managed. Controlling blood sugar and blood pressure is one of the most effective ways to protect your kidneys from damage. This might involve medications, but also includes lifestyle approaches like eating a balanced diet with less salt, staying at a healthy weight, exercising regularly in ways that work for your body, and not smoking. Fourth, stay well hydrated by drinking water throughout the day. Unless your doctor has advised you to limit fluids for a specific reason, think of water as helping your kidneys rinse out waste products. Finally, attend your regular checkups even when you feel fine. Many health problems, including kidney disease, are found through routine screening before they cause symptoms. This gives you the best chance of addressing issues early. A few important things to keep in mind. This information is meant to educate and help you have informed conversations with your healthcare provider, not to replace medical advice. Never stop taking medications prescribed by your doctor without discussing it with them first, even if you're concerned about effects on your kidneys. There are often ways to adjust treatments to protect your kidney health while still managing your other conditions. Not everyone with kidney disease will have all of these signs, and having one or two of these symptoms doesn't necessarily mean you have kidney disease. Many of these signs can have other causes. That's why medical evaluation is important to determine what's actually going on in your specific situation. The goal isn't to worry you, but to empower you with knowledge so you can be an active participant in your own health care. Thank you so much for taking the time to learn about this important topic. Your health is valuable, and staying informed is one of the best things you can do for yourself. If you found this information helpful, please give us a thumbs up and share this video with friends or family members who might benefit from knowing these signs. We'd love to hear from you in the comments. Have you or someone you know experienced any of these signs? What was your experience? Your stories can help others feel less alone and more motivated to get checked out. You'll notice there are 2 videos on your screen right now. We've created more content that we think you'll find valuable and interesting. We encourage you to keep watching and continue learning. Take care of yourself, and remember that seeking medical guidance when something doesn't seem right is always the smart choice.